Hello, everybody. First of all, I want to welcome and thank you all for joining this webinar. I hope you are safe and ready and happy to welcome a new year better than the one that we are leaving behind. I am Ornelia Tsulufe, and I will present the webinar today regarding EPTRI and EUPFI surveys, tools to investigate pediatric needs, as a member of Active Engagement of Children Working Group at TEDI, the European Network of Excellence for Pediatric Research. During the webinar today, we will start by presenting first what TEDI, EPTRI, and EUPFI are and which is their focus. We will present the surveys on oral formulations and pediatric device that are developed by EPTRI, the European Pediatric Translational Research Infrastructure, and EUPFI, the European Pediatric Formulation Initiative, and we'll go through them in details. Then we will conclude with the contribution of YPAGs and in revision of surveys and the help that YPAGs may give further in disseminating the surveys. The European Network of Excellence for Pediatric Research activities are constantly addressed to the promotion of adequate health policies, taking into account children's disease specificities and unmet needs of pediatric population. It pays particular attention to the theme of empowerment of pediatric patients in the healthcare field and to the active participation of children in the decision-making process, not only the daily clinical practice, but also and especially in all the activities related to the development and use of drugs. TEDI, the European Network of Excellence for Pediatric Research, is a partner of EPTRI. EPTRI, the European Pediatric Translational Research Infrastructure, is a new establishing pediatric research infrastructure that intends to make better medicines for children. It has arisen from the need to find answers to the serious lack of medicines for children in Europe and worldwide, and aims to enhance pediatric research and foster innovation for pediatric medicines. In the framework of EPTRI, a video toolkit has been developed to explain better what the translational research is and to provide information about basic research. I will play the video now for a better understanding.
Field of pediatrics, like in every other scientific area, researchers and healthcare professionals work based on scientific evidence, which is information or data obtained from scientific experiments and verified by the scientific community. But doing research in this field must take into consideration children's peculiarities. Children are very different from adults, mainly because their bodies are developing and constantly changing, and this will have an impact in all the experiments and trials performed by scientists. In pediatrics, basic research sows the seeds to grow new solutions for future medical use. But how does basic research build the foundations for these discoveries? Let's follow a case together. A treatment for the most common eye cancer in children, retinoblastoma, which involves the use of a genetically modified virus. First, different research groups from several countries joined together to communicate other researchers a promising finding: the use of certain viruses as a therapy against cancer. Several studies have been showing in a conclusive way the possibility of modifying some types of virus to get rid of carcinogenic cells. A translational research group wants to test this option, and to do that, it has to contact another research group who has the expertise to modify the virus. The biotechnology group takes the first step to carry out studies based on the knowledge of basic research groups. In this case, they have modified a virus which might now only attack cancer cells. The next step is to test it on biological models. With the help of the patients and their families, who donate samples of body tissues, researchers reproduce the encounter of the modified virus with the tumor at a microscopic level. It lays the foundations for the next step, testing in small animals. The accomplishments of the different research groups and the publication of their results make it possible to successfully try the potential therapy on children suffering from this type of eye cancer. A clinical trial can now be conducted. If the outcomes of the clinical trial are positive, patients gain access to a less invasive potential cure and with fewer side effects than previously available options. Nowadays, and thanks to the collaboration of researchers, clinicians, patients, and families, basic research in retinoblastoma has allowed the design of the first clinical trial to potentially treat this disease. To continue having a positive impact on children's lives, we need to involve them and their families in the whole research process. Together we can encourage patient-centric research in pediatrics. Help us help others.
Okay, the information and the material provided in the video maybe help also for training the young patients and to boost their engagement in the research and development process. The pediatric formulations are necessary to ensure that children of all ages and their caregivers have access to safe and accurate dosage forms of medicines. Medicines, as we may know, are chemicals or compounds used to cure, to treat, or to prevent disease or to ease symptoms and help in the diagnosis of illnesses. Many medications are taken orally by mouth or by inhalation by delivering drug to the body through the lungs. Medications may come as solids or liquids. There are many forms, as you may see. There are medications may be in form of tablets that are available in many different shapes and sizes. They could be coated tablets or mini tablets or chewable tablets. Another form could be the effervescent tablets. Another form of medications are also capsules that have a shell usually made of gelatin that contains the medication in the form of powder or granulate or liquid. Another form could be syrups that are usually liquids that are concentrated with sugar and contain medication and active ingredient within it. Another form could be drops that are usually medication dissolved in water or mixture water and alcohol, and the dosage in this case is given in number of drops. We have also some medications that are usually given as powder or granulate form. For the proper administration of medicines, it is important the usage of medical devices. There are different gadgets or devices that could be used, usually for the liquid formulations, such as spoons, measuring cups, oral syringes, and pipette or droppers. There are also some other devices that are used to give the medicine to the lungs, such as a nebulizer. That is a piece of medical equipment that a person can use to administer the medication directly and quickly to the lungs. it turns liquid medicine into a very fine mist that can be inhaled through a face mask. Or another form could be the metered dose inhaler. That is a device that delivers a specific amount of medication to the lung and is usually self-administered by the patient. Regarding the survey on oral formulations that is prepared in the framework of EPTRI, that intends to investigate children's experience with taking various pharmaceutical formulations. So in this survey, we are interested to know that how much children like the medicines they take and how would the children like their medicines to be. So in order to help us to improve the pediatric treatments on the basis of children preferences and needs. The survey is addressed to boys and girls up to 18 years of age and can be completed with the help of a grown-up if needed, but for sure we suggest that children, if they are able, to do it by themselves. No sensitive data will be collected, and all the information and collected data will be kept confidential. The survey will take about 5 minutes to be completed. And now I want to have a look to the survey and to go through the questions. I want to say that the link to the survey is at the chat section at the webinar panel. Here is the general part of the survey, which explain the aim of the survey. It is written all the information needed also regarding the sensitive data that will be collected. There are provided also the email address if you want to wish that your data to be deleted. Let's go further with the questionnaire. Here it requests to select one from the options. If it is the child that is completing the survey by himself, or it is an adult that it is helping the child to complete the survey. We will go forward. Here it is an general information that is requested for the adult. We have selected just some random alternatives. It requests the age of the adult, the gender, the relationship with the child, and the education of adult. At this section, it is the children that need to be answered. The first section is about the age of the children and then the gender. Here we need to make up a name for the children that is participating. I have written a random name, Dora, like Dora the Explorer. And then the general data regarding the children, such as in which country the children live in, where the children is born. You have to choose then one ethnic group that the children consider himself to be. If you go forward, there is a questions. Do you have a chronic illness? It is explained that this is a problem that lasts over 3 months or more. You have to choose one from the options, yes or no. The next questions, if you take medicines at home and you have to choose if you take the medicines many times, once daily or from time to time. Now we are at the most important part of the survey. You have to select the most favorite type of medicine from the below list that are in order: capsules, tablets. They are also with pictures and mini videos that are to help you to choose the type of medication. We have oral dispersible tablets, effervescent tablets, mini tablets, film, or granules. If there is another medicine that is not listed above, you should select other medicines and then to explain it at the box. Next question. You have to tell us if you have taken the medication before. So you have three options: if you are taking the medicine at the moment, if you have taken it in the past, or you have never taken it, and just provide an option from yourself. The next question is, what do you like the most about your most favorite? You have to order all the items that are below, from the most relevant to the least relevant. For example, if you like more, let's say, syrups, you should put from the taste, you should put the taste at the beginning. Or if you like more aftertaste, you can put her the second one, and so on. If there is any other reason that you like the medicine you choose, you need to specify at the box provided. The next question is, if you have taken this medicine before, have you felt any discomfort while taking it for the first time? And if you have felt the discomfort, if it has continued after the first time you took the medicine. Next, we also need to know your least favorite type of medicine is the same list as it was provided at the beginning. There are provided all the forms of oral formulations. Again, if any of the medicines is not provided in the list, you should write it in the box. And again, you should tell us regarding the least favorite medication, if you have taken it before, or you are taking it at the moment, or you never taken it. Again, you need to put in order the items that are provided. What do you not like about your least favorite formulation? For example, if you think that it is complicated to prepare or to take it, you should put it the first in the list. And then regarding as you think regarding the list, what you don't like about this. The questions are repeated again for the least favorite formulation. If you have felt any discomfort while taking it for the first time, and if the discomfort continued after the first time you took the medicine. Okay, we need to choose an option. So we can go forward. I am choosing just some random answers. At the end of the questionnaire, we want to know if if you completed the survey by yourself, or you had a little help from your grown-up, or a lot of help from the adult. And then by clicking the blue box, we go forward and submit the answers of the survey. Okay, the survey is still open and is available in 9 languages. There are 2 links in English, but there are for both UK and USA, because we used different links among UK and USA just for the collection of the results and to distinguish them among countries. We have the survey available also for Italy, for Albania, for Spain, for Romania, Czech Republic, Sweden, Netherlands, and Estonia. So far, the survey received 209 answers from Albania, over 500 from Italy, 161 from Netherlands, over 400 from Spain, 285 from Romania, and 131 from UK. The first results shows that the children's attitudes for dosage form are influenced by factors such as age, health status, and the frequency of medicine use, experience with certain dosage forms, whereas gender did not influence preferences. Liquids was the most used and favorite dosage form overall from less than 12 years old children. Tablets and capsules were mostly chosen by adolescents. The results from the survey also highlight the importance of direct involvement of children in such studies to understand which dosage form children prefer and to improve and develop new and highly accepted medicines. In addition, it is shown that the engagement of young persons in EPTRI helps in providing meaningful outcomes. So we would like to have your help with this study by filling it in by yourself, and why not to spread the word among your families, friends, and peers regarding this survey. Okay, the European Pediatric Formulation initiative was founded in 2007 by a group of members from the pharmaceutical industry, universities, and hospitals, working together in a non-profit way to promote the preparation of better and safe medicines for children. The EUPFI, in collaboration with EPTRI, has prepared this survey on pediatric devices. And this survey has been approved by UCL, University College of London, a Research Ethics Committee. The survey on pediatric devices intend to understand parent or carriers and children's views on devices used for the administration of children oral and respiratory medicines. It will help us to find ways for making the devices more user-friendly and to ensure that these devices are properly used and the correct dose of medicine is administered. The survey consists of 2 parts. It is the part 1 that need to be filled by the parent of the child. It provides also an information sheet for parents regarding all the details of the study. The consent form for parents and carers before continuing filling the survey, and the consent form that parents give for their child that is 10 years old or older to complete the survey by themselves. If the children is 10 years old or older, there is also the second part of the survey that could be filled by the children. It provides also the child assent form where the children should give their assent before taking part in the survey. And after making sure that he has received a complete information and he understands for what the study is about. Taking part in the survey is voluntary, and it will take about 10 or 15 minutes to complete the survey. All the survey data collected will be kept confidential throughout the study and when the results are disseminated. For further information, or if there are any questions from parents or children, or for the results of the study, once it has finished, the contact details are provided when you access the link of the survey. We will go again through the questions of the survey on pediatric devices. Okay, here is the general part of the survey where it explains what EUPFI is. We need to click here at the blue button. Here it is given the information regarding the devices and the aim of the survey. It is explained also the parts of the survey, and here it is provided the information sheet for parents and also the consent form for them. Here you may find also the contact details for any further information that you may need. Parents need to tick the box here and then to start the survey. The first questions, it is regarding the country, then continue if the adult is taking part in the survey on behalf of a child under 18 years old, and need to select the relationship with the child. Then we continue with the question if the child taken oral medicines or an inhaled medicine. You can choose one of them or both or none of the above. We continue further. Here is the question for parents about what type of oral medicine the child has taken most recently or is still taking. You should choose one of them or other, and to specify then if it is different from the medications provided. I will choose randomly just to go forward with the questions. Then you have to select which device you use to measure the medicine selected above. There are provided also different forms of pediatric devices that we mentioned also before. The next question, for how long the child used this device to take the medicine that you selected above, you have to choose one of the options. Then you have to give information regarding how many times a day did the child use this device to take the medicine, if it was once a day, twice a day, 4 times a day or other if it is different from the options above. An important questions, it's also how easy did you find the device to use? If it was easy, difficult, or neither easy nor difficult to use the device. We want to know if the instructions on how to use the device were given to you. And then move forward with the questions. The next question is, who gave you the instructions on how to use the device? You can select all that apply, for example, doctor, pharmacist, or nurse, or just from patient information leaflet. Next question is, how clear were the instructions to follow? If the instructions were clear or not clear, or you don't know how to call these instructions. The next question that is important is, what could companies do to make the oral administration device that the child is using more user-friendly? For example, to change instructions, or it might be, for example, to make colorful cups or spoon or oral syringes with cartoons. You may provide your opinion here. Then we go forward. It is the question, how old is your child? And here, if the child is less than 10 years old, you click one from the options and the survey will end here. But if the child is more than 10 years old and up to 18 years old, we can go forward with the survey. And here it is provided the consent form for a child that the parent needs to give. I will select yes and go forward. Now we are at the second part of the survey that needs to be completed by the children. The document with the information and the assent form is provided for children. They need to tick the box that are happy to take part in the study and then to start the survey. They need to give information about their age. They need to provide information if they are taking an oral medicine or inhaled medicine, or both, or none of the above. The children should select the type of oral medicine or inhaled medicine that is taken most recently, or it is still taken. All the oral formulations are also with pictures, so it will be easy for the child to choose one from the options. The same also for the device that the children and the parent use to measure or to take the medicine above mentioned. Then we have again the questions for how long did the child use this device, how many times per day, if it was easy for the children or difficult to use this device, if the instructions were given to the children for how to use the device. The children also need to choose who gave to them the instructions on the device, if it is maybe parents, doctor, pharmacist, a nurse, or by patient information leaflet, or if it is different, they should specify in the box below. And they need to answer how clear were the instructions provided. and they need to give their feedback again about what could companies do to make the oral administration device that the children is using more user-friendly. After providing their answer, they click the blue arrow and the survey is submitted and so completed. Let's go back to the presentation. The survey on pediatric devices is open in different languages, such are Albanian, English, Italian, and Spanish. Also, the links to the surveys are provided at the chat section at the webinar panel. We need to emphasize that a precious contribution is given by YPAGs in the surveys. YPAGs, that are Young Persons Advisory Group, are composed by young people aged between 8 and 18 years old that are healthy youth or could be patients with interest on medicine and research. We can say that the YPAGs now are a model adopted across Europe as eYPAGnet or and globally also via ICANN network. The YPAGs learn about and give their feedback in various aspects of research and clinical trials on medicines. Both the surveys were reviewed and translated by the Young Persons Advisory Groups of Albania, Barcelona, and Bari to make the language and layout more child-friendly. We are now inviting you to fill the surveys, and we need your help to disseminate the surveys among your families, friends, or peers, also through your social media channels or school websites to help us to work and to make better medicines and devices for children. I want to thank you all for your patience and your time here. If there are any questions, you can write them at the webinar panel at the chat section. We will wait just a few more minutes. Will the survey will be available in French? Yes, in fact, it's a good questions. I think that if you are interested in the survey to be translated in French, we can provide you with the survey, the Word version in English, and or we can proceed by translating it and make available also in French language. I will write again the email address where you can address your questions, or like this case, if you want the survey to be translated also in French. I will provide the email address at the chat section. No, we do not have a date about when the survey will be closed. It will remain open, I think, for more time. Yes, thank you, Amy. The surveys are available also at the website of ICANN. It seems that there are no more questions, I want to thank you again, all of you, and to remind again to please disseminate as much as possible the survey. We need too many answers in order to make progress. I take the occasion to wish all of you Merry Christmas and enjoy your holiday season. Bye.